Hi everyone, my name's Isabel O'Sullivan. Before I start, I'd just like to acknowledge my supervisory team, Arthritis Australia for funding this study, and Vasily for providing the inserts. So today I'll be presenting preliminary findings from a feasibility trial that we're just completing. 1/3 of adolescents have patellofemoral pain. Expert consensus defines it as pain around or behind the patellofemoral joint that is aggravated by at least one activity that loads the patellofemoral joint during weight bearing on a flexed knee, so squatting, stairs, or running. We know that adolescents with patellofemoral pain are less active than those without, and we know that this can affect their health long term. What we also know from the literature is that adolescents tend to have poorer outcomes with physiotherapy treatment than adults, and this may be explained by the fact that they present with different impairments than adults and also have lower adherence with treatment. The 2018 consensus statement recommends the use of foot orthoses to reduce patellofemoral pain in adults. Orthoses may be the answer for adolescents in terms of issues around adherence, so they can easily be placed into their shoes with no effort. Some preliminary findings from a study by Engen Peronowski supports further research. So this was a small study that used 20 adolescent females with bilateral patellofemoral pain and looked at flat versus contoured orthoses. However, this was a very small population, and the types of inserts that they used were a flat insert with a medial wedge for their contoured orthosis, and this is quite basic compared to what we see with orthoses constructed today. So there needs to be further investigation in a more modern context and a larger cohort before we actually go on to conduct this full-scale RCT. However, we need to determine if it is feasible. This takes me to my aims. So the aim of this study is to determine the feasibility of conducting a full-scale RCT, evaluating the effects of foot orthoses in adolescents who have patellofemoral pain. The full study protocol is available in the Journal of Foot and Ankle Research. Today I'll only be discussing the primary aim. For more information on our secondary aims and looking at treatment effect sizes, please look at the protocol paper. So just to run through the process of the study here, eligible participants completed the baseline measures. So what this showed was that participants were on average at about 15.5 years old. They were 75% females, a large proportion of bilateral presentations, and had their symptoms on average for about 3 years. Participants were then randomized to receive either the flat or the contoured orthoses. And in terms of contoured, we used the flat, full length, so that was more suitable for sport shoes, 3/4 length that could easily be transferred between shoes and suitable for school shoes, easy fit that could be used in narrow shoes, so when width was an issue, and the slim fit that was more suitable for dress shoes. And in terms of the flat inserts, just to show you what this looks like, so you can see here that they have no contouring. They are completely flat along the whole insert, and the covering fabric is identical to that seen with contoured orthoses. So they attended their practitioner appointments to be fitted with the intervention, and then completed their outcome measures again at 6 weeks and 3 months. I am blinded to the analysis, so I will be presenting the data today as Group 1 and Group 2 until secondary outcome data analysis is complete. The primary outcomes was the feasibility of conducting a full-scale RCT. So how we analysed that was through willingness of participants to enrol in the study, number of eligible volunteers, recruitment rate, adherence with the allocated intervention and logbook, any adverse events, success of blinding, dropout rate, and then also the participants' credibility and expectancy of the treatment. So just to go through each of these in a little bit more detail, participants inquired to participate in the study through social media. So 265 people completed the online survey, 47 consented to the physical screen, and 36 were eligible. So that made number of eligible participants 77%. Primary reasons for exclusion were currently wearing orthoses, history of lower limb surgery, and diagnosed other type of anterior knee pain. So what we can take home from this was that the online screening was successful in excluding ineligible participants, and there was a high rate of eligible participants post physical screening. The parameter we set to inform feasibility was for recruitment rate was 1 participant per week. So we achieved this starting recruitment at end of August 2019 and finishing end of April 2020. As you can see from the graph here, there's a slight drop off through that Christmas New Year's period, and then again in April with COVID. And we made the decision to stop recruiting in April due to COVID restrictions. Logbook completion was relatively low at 42%, with 15 participants having completed and returned the logbook. The parameter we set for adherence with the intervention was to be worn for at least 2 hours a day, 5 days a week. Logbook completion demonstrated moderate adherence with a higher rate for group 1. So we can't say what the adherence was in those who did not return their logbooks, and what this tells us is that we have to look at a different way of recruiting this data in the full-scale RCT. Only one minor transient adverse event was reported through the process of the study. One participant in group 1 experienced some rubbing of the intervention in the second week. However, this resolved by week 3. Here is the credibility and expectancy questionnaires. So when examining patient thoughts in set 1, you can see that both groups have scored more towards very logical when being asked about the course. Similarly, in question 2, when being asked about raising their quality of functioning, the parameter we set for feasibility was no more than 2 categories difference between groups. Both groups would be confident in recommending this course to a friend and had higher scores in their beliefs around improvement in functioning after being fitted with the intervention. And when examining patient feelings in set 2, both groups scored above midway with higher scores for how much they really feel their functioning will improve or how much improvement will occur. So the take-home message here is that people in both groups thought that the treatments were logical. As discussed in the previous slides, there were no notable differences between the groups for credibility and expectancy outcomes post being fitted with their allocated intervention. So these scores are just in numerical form here, and this demonstrates success of blinding. In terms of dropout rate, one of the parameters we set to inform this was less than 20%. So on analysis, the final number for loss to follow-up was 36%. This seems high, however understandable when considering the circumstances with recruitment and physio appointments overlapping with the start of lockdown. The last few participants were recruited in March with their follow-up appointments planned for April, and when we subtract those last 5 from the analysis, that dropout rate falls within the 20% leeway. Based on the parameters set to inform feasibility, this can be considered a feasible study to run as a larger RCT. Willingness to enroll or entry rate into the study was 14%. We considered this reasonable based on previous studies. Number of eligible volunteers was high at 77% post-physical screening. A recruitment rate of 1 participant per week was achieved. Adherence to the allocated intervention was relatively good. However, only 15 participants returned their logbook. Dropout rate was higher than expected. The parameter we set was 20% or less. However, this high dropout rate could be considered and needs to be considered around COVID restrictions. A parameter set for credibility and expectancy was no more than 2 categories difference between groups for each question, and this was achieved in addition to the scores indicating success of blinding. And finally, only 1 minor transient adverse event was reported. So given the high prevalence and burden of patellofemoral pain in adolescents and the potential long-term sequelae of patellofemoral pain, this study is an important first step in identifying appropriate and efficacious interventions for this population. Thank you.